مساء الخير. I do thank you very much for inviting me to speak in this conference. My topic is about the abdominal distension in the pediatric age group. هو actually يعني لما كنا بنفكر في المحاضرات وعناوين المحاضرات، احنا كنا عايزين نشوف امتى بلاقي in a certain symptom a warning sign or something important that يعني mandates further investigation or referral for a more complicated situation. يعني يبان من العنوان just an abdominal distension or bloating in pediatric age group is not always something simple. My references was some recent articles in the management of the chronic abdominal distension and bloating, clinical gastroenterology 2021, and a practical approach to the diagnosis and treatment of abdominal bloating and distension, gastroenterology February 22. Another article which was published in 2019 about the clinical approach and management of the abdominal distension and bloating. First of all, I wish to show what's the difference in the definition between just a bloating, which is a distension, which is not increasing in the size of the abdomen, but just to feel something like fullness in the abdomen. Distension is an increase in the size of the abdomen. The topic today is an increase in the size of the abdomen and not just a bloating, and sometimes both symptoms combine together. So by definition, the abdominal bloating is characterized by symptoms of trapped gas, abdominal pressure or fullness, and the abdominal distension is defined as measurable increase in the abdominal girth. These symptoms might coexist, and sometimes functional abdominal bloating and distension commonly coincide with the functional dyspepsia, irritable bowel syndrome, and functional constipation. We want to see the abdominal quadrants. It's either divided into 4 quadrants: upper left, upper right, lower left, and lower right. And the middle regions, the epigastric region, the periumbilical region, and the pelvic region. And as we see in each quadrant, the left upper quadrant, it contains the stomach, the left kidney, spleen, colon and pancreas, and the right upper quadrant contains the liver, right kidney, gallbladder, and colon. And so we should know when we examine the abdomen what's the contents in each quadrant. So if we have the pain related to the left hypochondrial region, this is another classification or another divisions in the abdomen. It is 9 quadrants and not only 4 quadrants. But still, we want to know these are the central lesions. Here we can find something related to the stomach or the pancreas. Here we can find something related to the spleen. The right hypochondrium is related to the liver and the gallbladder, and so on. So again, what's the causes of abdominal bloating and distension? The abdominal distension may occur just due to air entrapment or fluid entrapment and its accumulation inside the abdomen. The definition of bloating and distension is a definition of another disease. Yani, this means that we have a symptom with an underlying disease. I have to dig more and to investigate to find this disease. What disease is a disease we are dealing with? irritable bowel syndrome, we can find an irritable bowel syndrome which may be manifested by a long-term condition of digestive system, different symptoms like stomach cramps, bloating, diarrhea, and constipation. And these symptoms may change over time. We have very common differential for the abdominal distension. We have 5 Fs and a newly added, or what we want to add, the 6F. We have the flatus, fluid, fetus, and fat. And the 6F is for a filthy big tumor or a fatal tumor. So it's not only a fluid, it's not only gases or fecal matter or a fat in the tummy, but we have a tumor. I should ask for the general condition of the patient. When I see a distended abdomen, I should ask for the general condition. Is the patient active, or there is a problem in the activity, the pallor, pain in other areas, other swellings, the site of this distension, and the duration in which it occurred. And I should examine the patient not only in the abdomen, of course, but generally looking for other swellings or organomegalies. If I found a mass, I should dig more to find the site of this mass and the size of the mass. So what is the causes of the focal abdominal distension? It depends upon the quadrants, as we mentioned before. If we have in the epigastrium area, I can find benign causes and I can find malignant causes. So there may be some kind of duodenal atresia, gastric problems, pyloric stenosis, and I can have still a problem in the esophagus or in the stomach. When we go to one of the flanks, we of course we may found some kind of tumors like the Wilms tumor, the renal tumors in general, or something like neuroblastoma. We can find something in the adrenal region, something benign in the adrenal regions like benign adrenal hyperplasia or adrenal hemorrhage, or of course we can find inflammation in the kidney. In the left upper quadrant, we might have splenomegaly, splenic cyst. In the right lower quadrant, we might have ovarian mass or intussusception or something inflammatory. What I want to say is that in each part of the stomach, I can find something benign or malignant. So what can take my my vision, or what makes me alert for something more serious? These are the alarming signs. This is my message. When I look for an abdominal distension and I find a mass, it's something serious. When I look in abdominal distension and I find bleeding, it's something serious. The bleeding might occur with the vomiting. We have something like hematemesis, or bleeding per rectum. The bleeding may be something like melena, denoting that I'm dealing with a bleeding from the small intestine, or something fresh, and this fresh blood denotes that I'm dealing with something happening in the rectum or in the distal area of the colon. So mass bleeding, vomiting also can denote that I'm dealing with something important. Fever, fever with an abdominal distension that makes me think that I'm dealing with an infection, difficulty of swallowing, and dysphagia denotes that I'm dealing with something in the oropharynx, esophagus, or stomach. Weight loss, of course, is something very important. Chest pain in the upper abdomen with abdominal distension might alert us that we are dealing with a cardiac problem and cardiac ischemia. Other circumstances are sudden change in the bowel habit or the gut symptoms. The patient is always constipated and is having a severe diarrhea, and of course it's chronic diarrhea. Nighttime pain denotes structural abnormality, or if I'm having a similar condition in the family. Of course, as we know, the cancer colon can occur in the families, and I should screen with a colonoscopy to find a precancerous polyps in such situation. Bleeding or one of these warning signs mandates further investigation like upper or lower GI endoscopy and CT abdomen. If the distension or is associated with an abdominal pain, still I have to look for the quadrants, the 9 quadrants, and the red flags. So I have to make sure that I'm not dealing with something serious. And as we said, we have 10 red flags that I should take care of, and I should take care of the site of the mass and the site of the pain to detect the abnormality. Conclusion, abdominal bloating and distension are highly prevalent symptoms. They have a wide spectrum of underlying medical and surgical disorders. Symptoms of bloating and distension are inherently non-specific. I'm not dealing with a specific symptoms, but they identify an underlying etiology. When I have an abdominal distension, I should not just treat an abdominal distension, but I should look for a structural underlying etiology. You have to remember the warning signs. There are 10 warning signs. You have to assess the dietary, medication, surgical, and behavioral factors that could contribute to the pathogenesis of the bloating, and consider the main underlying physiologic processes that underlie bloating and distension, which guides me to find the proper treatment guidelines. Thank you very much.
Thanks so much, Dr. Wael, for this